and good morning, everyone. My name is Bill Hauter. I'm the state representative for the 87th district, which is a lot of Tazewell County, Logan County, Morton, Clinton, Lincoln, Illinois. And I'm also a practicing physician. I'm board certified in anesthesia and also emergency medicine. And I'm the chairman of the Department of Anesthesiology at OSF Hospital in Peoria, Illinois. So I should also mention that I'm in the ORs today, and you may hear some overhead noise, and I'm sorry for that if that's true. But I'm actually in the ORs, and I'd like to talk to you today about a hearing we had with IDFPR, and I'm on the healthcare licensing committee, and we have had a frustrating increase in the delays in healthcare professionals licensing, and it's become a problem that just has to be solved because of the delays in healthcare licensing for many professionals that previously during the pandemic, we had a expedited process. And since that has ended, we have gone into basically a disaster of healthcare licensing. Patients are suffering because healthcare professionals cannot get licensed in Illinois. Medicine has become very mobile, and we are getting temporary workers. We're getting what we call locums workers from other states, and also new healthcare providers, whether they be physicians or dentists or pharmacists, that are coming to Illinois or newly graduated are having immense trouble getting a license. And we don't know if it's going to be, 2 months, 6 months, 8 months, and there's horror stories all out there. I would tell you a typical story, but it's a horror story. Every story has become just a absolute disaster of trying to get their healthcare licenses through Illinois. And it's not like it's a problem all over the country. It's just in Illinois. And so you look around states around us, and we're talking weeks before they get their license. In Illinois, it's months and months, and it's variable. There's no time frame that we know when we can get our license, and there's no one answering their phones, and patients are suffering. Patients are delaying their care. Patients are going elsewhere and to other states to get care because they cannot get someone that can take care of them. For example, if you were a newly graduating surgeon and you had a job offer, and so let's say you're from Indiana, you were graduating for residency July 1st. After 8 years of medical school and surgery residency, you're finally going to get a highly compensated job in Michigan or maybe in Indiana, or you're looking at a job in Illinois. Those states can start you working within probably as soon as you graduate or soon after. Would you take a job in Illinois when you may get a license in September? You may get it in December, or it may be, the next year before you could get a license to practice surgery. It's not only patients are suffering, but Illinois is suffering. When we're talking about in this day and age of trying to bring people to Illinois, keep people in Illinois, and we're talking about some of the most highly compensated jobs in our economy, whether it be physicians or dentists or nurse practitioners or PAs or pharmacists or veterinarians or CRNAs, all these people are having immense trouble trying to get their license. These are people that are not only highly compensated, but their tax dollars and the people that they serve, all of these people are part of the ecosystem to keep people in Illinois. And we're failing them, and we're failing Illinois. And it's outrageous, and it's untenable. So I'm talking to you today, and I think there can be a bipartisan solution. The chairman of the healthcare licensing committee, Chairman Morgan, is very attuned to this. This is a win. This is a bipartisan win. All Democrat legislators and Republican legislators are having so many troubles. Our offices are inundated with people having trouble with their licenses. And so I think we can go back to, and we can in the veto session address this. We need to address this on emergency fashion. We can go back to the temporary system, to the emergency licensing of healthcare professionals. And also, it's part of licensing 101 that when you send in your information, all your information and your credentials to be licensed in some healthcare profession, that you would get some receipt that they've gotten all your information, they've cashed your check. But that's not done in Illinois. And so, again, patients are suffering because someone is not moving a piece of paper from one, place to another. And we don't have to accept that. And so I think that we can find a bipartisan solution. This would be a perfect case where we can get together a veto session and change things. We have to. So thank you for listening to me, and thank you for coming. And